Hello, my name is Susan Pressler from Indiana University, and I am presenting this PowerPoint session with Dr. Debra Moser from University of Kentucky. And we are happy to talk with you today about writing abstracts for scientific conferences. Our goals for the presentation today are to describe methods for writing a scientific abstract for presentation at a national meeting, present tips for writing successful abstracts, and to provide examples of strong abstracts for you. Before you begin to write, there are a few things you need to do first. Before you begin to write, first review carefully the call for abstracts guidelines. What is the purpose of the meeting? Who is the audience? What is the format, including the word limit for abstracts? How is the abstract submitted? Today, most abstracts are submitted online on a website. You may need access to the website to upload the files. Do the abstracts say that only database studies can be submitted? Do they mention that only completed studies be submitted? So you really want to take some time to think, is this the best place to present my work? Consider carefully the link between the call and your study. Look at the peer review process and find the evaluation criteria that will be used to review the abstracts. Reviewers will use the criteria, and you want to be sure your abstract meets the criteria and is competitive. It takes time to write a good abstract, so start early, and often you want to obtain feedback and input from your colleagues and other people. Experience really helps when you're doing an abstract, so try to find a mentor or a colleague who has submitted abstracts and can assist you. Review examples of other abstracts that are published in journals such as the American Journal of Critical Care or Circulation, or Journal of Cardiac Failure, or Progress in Cardiovascular Nursing and Heart and Lung. A few writing tips. You really want to strive for perfection and precision in writing your abstract. Be sure that you have carefully checked spelling, so there are no spelling or grammatical errors and what we call typos, because you want it to look as good as it possibly can be. Limit the use of abbreviations. Too many are very distracting. Think about the audience and if they're familiar abbreviations, or if there's something that people are going to need to remember as they go through the abstract. A general rule is no more than 3 to 5. Follow carefully the guidelines for the word limits, the margins, and the font size. These are guidelines, or adhering to these guidelines will be helpful in getting accepted. Writing a scientific abstract. These are the parts of the abstract: title, background, objective, method, results, and conclusions. The exact headings may vary according to the organization's guidelines. We'll go through each of these areas now. We recommend using structured abstracts. Structured abstracts have subheadings to separate parts of the abstract. This method makes the abstract easier to read and clearly identifies the parts of the study. For the title, make it descriptive of the work, important, and compelling to the reader. Here are examples for titles of the same study: Quality of Life Among Stroke Survivors, Depression and Functional Status Predict Quality of Life in Stroke, Or, do depression and functional status predict quality of life in stroke survivors? Which one sounds the most descriptive, important, and compelling to you, and why? These are real-life examples of abstracts. You can see by the use of the question that sometimes is compelling or adds a degree of interest. For example, what happens when heart failure patients don't know what they don't know? That also has a bit of alliteration to it that catches the reader's attention. The next one's very descriptive: depressive symptoms, poor nutritional intake, and event-free survival in patients with heart failure, a deadly chain of events. So that's speaking to the importance. Increased body mass index is protective against low bone mineral density in patients with heart failure. Again, very descriptive and compelling. And comorbid anxiety and depression, dynamic duo of death. Again, speaking to the importance and trying to compel to the reader that this is an important topic we're studying. The background is often brief in an abstract, usually only 1 or 2 sentences. You want to spend the majority of the time on your results. So use a problem statement approach. Despite the fact that blank number of strokes or MIs or whatever condition you're talking about occur annually, little is known about or information is lacking about. This is a good way to frame the problem that you're going to be addressing in a very succinct way. Here are some examples of background. Little is known about the relationship between variable 1 and variable 2 and then you can state the population. Or here's another example. Hypertension contributes to mortality in patients after stroke, but interventions to improve antihypertensive medication adherence in these patients are lacking. Here is another example. You will want to include objectives or purposes in the abstract. Limit this section to 1 or 2 sentences. You want them to flow directly from the problem statement that you identified in the background. It's a critical element, the objectives are, because they tell the reviewer exactly what to expect in the rest of the abstract. And the reviewer will make judgments about the importance of the topic based on this section. Here is an example. To examine the relationship between variable 1 and variable 2 in persons with, and note in the background you talked about little was known about these 2 variables. You can see the link. This is another example of objectives and purposes that link closely to the background statement. Also note that in this example, in the objective, the intervention is in the objective, the outcome variables are listed, and the sample is presented. So the reader knows exactly what's going to happen in the rest of the abstract. This is an example of a title, background, and objective that are all linked together. Please read them and critique them. What is missing? What could have been done better? What did you like about it? Here is another example of a title, background, and objective that are closely linked and describe exactly what the study is about. Now we are at the methods. You want to very succinctly tell the reader the design of the study, the procedure, the sample, the measurement, if possible, if there's room, operational definitions, what the groups were if you were analyzing by groups, and statistical analysis, if it is not in the results section. The methods section is important because it does have the detailed methods and it tells the reader what to expect in the coming results. It gives us a lot of information about the quality and strength of the study because it presents the design, measures, and sample information. Here is an example of a methods section that includes design and sample information as well as some of the measures and the statistical analysis. Here is another example of a method section. Please read it. See how it integrates very well the methods of design, measurement, samples, and analysis planned.
Hello, this is Debra Moser, and I'll be following that great presentation by Susan Pressler. She got us up to the results section, and I'll be discussing the results, what to put in the results, and in the conclusion, and several other aspects of making a great abstract. With regard to what makes a great results section, it's very clear that data are essential. Reviewers want to see the data. They want to see data that are presented that directly address the purpose. They want enough detail to address the specific aim, to be able to assess that you appropriately address the specific aim. They don't necessarily want to be buried in minutia, so avoid adding all sorts of data that aren't directly related to the purpose and specific aim, largely because you won't have enough time, but secondly, because it's important to really avoid confusing reviewers and readers with detail that isn't necessary to the abstract. Finally, never say that the results will be discussed. You need a succinct summary of the exact details of the findings that you have. Let's now take a look at a nice results section. So take some time to read this. You'll see that it presents a relatively complicated results section very clearly, very succinctly, and in enough detail for the reviewer and the reader to understand what was done and to properly assess that you answered your specific aims, or you appropriately addressed your specific aims. You see that this results section includes the data analysis plan that was used, the variables that were controlled for, the independent variable, and the predicted outcome. It provides p-values and a nice figure. Reporting these sorts of data from a Cox proportional hazards model in words in a results section is very difficult, so it's a perfect place to have a figure. And then the writer of this results section interpreted the figure and the data so that you clearly understand the finding that was reported in this results section. Here's an example of another well-developed results section, and let me read through it and point out some of the grid points. So mean UNA, which was 24-hour urinary sodium excretion, important to abbreviate something that long, although too many abbreviations can be annoying. That is just way too long to take up so much space in an abstract, so it was abbreviated. We have the actual data was 190 plus or minus the standard deviation of 96 millimoles. There were no differences in event-free survival between patients divided at either 131 millimoles, and we have the p-value, or 174 millimoles, and again we have the p-value, and these are cut points for the 24-hour urinary sodium excretion that correspond to 2 gram and 3 gram sodium diets. When stratified by New York Heart Association class, event-free survival in class 1 and 2 was similar regardless of cut point. In contrast, patients in class 3 or 4 with urinary sodium less than 131 had significantly longer event-free survival than those with urinary sodium excretion above 131. Event-free survival, however, was equally poor when New York Heart Association class 3 and 4 patients were compared using that cut point. And we see we have p-values here. We pretty much have all of the data that we need to properly interpret these results. Let me spend a little time now talking about the use of figures and tables to add impact to your abstract. Obvious advantages of tables and figures is they make a powerful visual statement. So much data is available in a table or a figure that you just could never put in words into an abstract. It's easy to interpret without lots of reading, and it really catches reviewers' attention because most people don't use tables and figures. Disadvantages, they take up a lot of space and really decrease the number of words you can use. If they're not properly set up and adequately labeled and are incomprehensible, they irritate reviewers. So that's a very important disadvantage to take account of. So you really want to have other people take a look at your tables and figures to make sure that they really have appropriate labeling and set up so that they're easily interpreted by any reviewer. This is a good example of the results augmented with a figure. So this results section provides data, gives us the number of patients and the percentage who were underweight, normal weight, overweight, and obese, the number of deaths that occurred in the entire sample, talks about the variables that were controlled, and concludes in the results that the BMI was an independent predictor of mortality. And then refer us to a figure that presents the cumulative hazard of the end result. And then we interpret in the results section, underweight and normal weight patients had 3.6 and 2.1 times higher risk of death than overweight or obese CHD patients. And I really can't emphasize enough the importance of interpreting your results for people who aren't that familiar necessarily with survival analyses or other sorts of analyses that they don't often use. This is the figure that accompanied the previous text, and I think it's a very nice figure that is very well labeled. We have the x-axis and the y-axis very clearly laid out. We have each of the lines in this hazard curve clearly labeled so that we know who were underweight, normal weight, overweight, and obese. And we show, this is, as opposed to most survival curves, this is actually a hazard curve. So we see that the underweight group has the greatest risk of probability for death or rehospitalization. Normal weight, the next risk, and those who are overweight or obese having the least risk. And just for those of you who are interested, this is referred to as the obesity paradox in heart failure. But a very nice use of a figure to supplement text. These next two slides also provide an example of text supplemented by a figure. This results are about the presence of depressive symptoms independently predicting rehospitalization and mortality, our endpoint. It gives the odds ratio and the p-value, something that reviewers always want to see. It interprets it, saying that patients with depressive symptoms were less adherent than non-depressed patients to medication-taking behavior, and then to other adherence, lifestyle changes, behaviors. And then in the results, the person also talks about the things that were not associated and indicates the results of a mediation analysis that was conducted. And this is the figure or the bar chart that accompanied the previous results section. And I think you would agree that it captures our attention. It very nicely demonstrates on the association, but the association between depression and medication adherence. We see the people who have depressive symptoms versus no depressive symptoms, and we can see that for each indicator of medication adherence, the people who had no depression were more adherent than the people who had depressive symptoms. So very clearly showing the results. The last two slides for the results section present, again, text supplemented by a very nice figure. Again, when you read this results section, you see that it's short, succinct, it doesn't have extraneous information in it, it directly addresses the specific aim, and is supplemented with a very nice figure that you'll see on the next slide. This is the figure supplementing the previous text, and you see it very clearly is labeled. It has a title across the top, the X and Y axis are clearly labeled, and the lines are labeled so that we can see persistently anxious people had substantially worse event-free survival than all others. All right, now let's move on to the conclusion section, the last section of the abstract. And this is the part where you really have a chance to grab the reviewer. And let's talk about what makes a great conclusion. First off, a really good conclusion does not simply repeat the results. It interprets the results and considers your results in the context of existing literature and in the context of what it means for practice and for future research. Do not say they will be discussed. I've read that in conclusion sections, and it really doesn't go over well with reviewers. And this and the subsequent few slides, we have some examples of good conclusion sections. If you take a read of this section, you'll see that it doesn't just simply repeat the findings. There's a little summary of the results. Even in patients with stable CHD, overweight and obesity predict survival. And then there's a discussion of the possible implications of the findings. Although the mechanisms underlying this association are unknown, physiologic or behavioral correlates of overweight may mitigate the negative consequences of CHD early in its progression. So it suggests some explanation for the finding that was demonstrated, and in doing so, suggests some further avenue for research into this area. This is another nice conclusion section in which you have a nice summary, a succinct summary of the findings, not a repeat of the findings. The level of sodium intake of patients at NYHA class 1 and 2 did not affect event-free survival. Patients in class 3 and 4 had better outcomes if sodium intake was limited to 3 grams or less. And then the final conclusion, these data provide support for a 3-gram dietary sodium restriction in patients with advanced heart failure. And that's a nice conclusion. It's a strong conclusion, it's a recommendation, and it also sets up the stage for clinical uptake and further research. This is an example of a nice, short, straightforward conclusion section. By measuring anxiety at more than one time point, these data illustrate that persistent anxiety is a strong, independent predictor of event-free survival. This is a little shorter than most because of the limitations of the abstract site to which it was submitted. But it still nicely demonstrates not a repeat of the results, but a summary, an integration of all the results, talking about persistent anxiety as an independent predictor for event-free survival. This is a final example of a nice conclusion section. It says that non-adherence is associated with worse event-free survival, but the worst outcomes are seen in those unrealistic about their non-adherence and believe or report themselves to be more adherent than they actually are. And the conclusion, the straightforward conclusion, is that depending on patient self-report of adherence may have negative consequences. I'm now going to move to talking about what reviewers really look for when they're deciding to rate an abstract higher or lower. It's as important to understand what reviewers want to see as it is to write a relatively good abstract, so you can include the appropriate things in your abstract. So reviewers look for immediate impact. They're reading often 50 to 75, even 100. I've read 100 abstracts at a time as a reviewer, and that, given the short turnaround time you usually have, the other demands on your time, you really, when you look at these abstracts, you want to see something that makes an impact on you, that piques your interest. Immediate impact can be found when you use an informative title, you really have a significant problem addressed, the abstract is clearly written, it has good data in it, and it has a striking conclusion that builds on the data. And hopefully we've led you to the place where that's what you would expect to write in an abstract. There are several things that it's nice to remember about reviewers when you're writing your abstract, and really helps you focus on what would make your abstract distinct from all other abstracts. And I love this picture. It's a black and white kitty and a bunch of black and white bunnies, a mom bunny and some baby bunnies. And it sort of shows, it illustrates to me the task that reviewers have. They're looking at 50 abstracts that all look pretty similar, and they want to see the standout. They want to see something that is different, that really catches attention, that is different from the bulk of the other ones, that will really make the meeting more interesting. Another important thing to remember about reviewers is that they're likely doing reviews late at night after all of their other obligations. So reviewing abstracts is an added-on responsibility that many accept as part of their professional obligation, but they're doing it at night when they're tired, and you really don't want to put the reviewer, in the position of falling asleep or losing interest because you've written a boring abstract, one that's not clear, that's really difficult to understand. They just won't give your abstract the time it might deserve if you write that sort of abstract. So try to be very clear, try to be interesting, use all of the tips that we've given you to keep that reviewer awake late at night. Another important thing to remember about reviewers is that they are most likely not experts in your specific area of research. Although they're experts in the general area, few reviewers are expert in so many areas that they understand the unique nuances of research in all areas. So avoid jargon that's unique to your area. Don't assume that everybody understands why your study is important. It's your job to tell them why it's important. And the better job you do, the better your chances of having your abstract accepted are. Avoid writing in highly technical, obscure manners. Don't use jargon. Write something, or highly technical terms. Write in a way that's understandable to an intelligent layperson. That's some of the greatest advice I've ever received about writing a good abstract. Use simple, straightforward, small words. Small words always work better than larger words. And don't waste your words. Really read every word of your abstract and make sure that information is provided in every word. You'll always run into the case of having an abstract be too long and then feel that you won't be able to decrease its size. But it's very possible to do by eliminating wasted words, and many words are wasted in abstracts, and eliminating them makes your abstract very clear. As writers, we often fall in love with our own writing. We're so entranced with some great sentence we've written that nothing could make us eliminate it. But I always like to point out this great quote by Samuel Johnson. He said, "Read over your compositions, and when you meet a passage that you think is particularly fine, strike it out." So it makes a great case that really nothing you've written is so wonderful that it can't be edited. Final things to remember about reviewers relate to keeping in mind the task that they've had, and I've talked about the task facing reviewers, and their mindset when they approach your abstract. You should always give yourself enough time so that you can follow the directions exactly. You give yourself time to get critical input from all authors and from other colleagues who aren't authors, people who aren't that close to your research, so they can actually give you the perspective of an abstract reviewer who possibly isn't an expert in your area. You need to proofread several times to avoid making bad spelling errors and other errors that you'll regret later on. You need to get other colleagues to proofread, because we have a tendency to see what we want to see, and we often miss misspellings, especially if you misspell something with another word. For example, I once wrote in the title of an abstract the word heat instead of heart. And it went unnoticed by myself, by my colleagues, and I should have had another colleague outside of the authorship list read my abstract, and somebody would have noticed that I used the word heat instead of heart. And then proofread again after setting it aside for a few days, so you really can bring a new perspective yourself to the task of reviewing your abstract. Once an abstract is submitted and the deadline is passed, it's impossible to make changes to it. There's no abstract submitted to any professional organization that I know of that's editable after the deadline is passed. So even if it's to be published, no editing is allowed of abstracts after submitted. There are a few other things to consider when you're working on your abstract. First, conference participants read your abstract to decide whether to attend your presentation. So the more interesting your abstract, the more well-written, the better chance you have of people coming to attend your presentation. Your potential audience can be huge and varied, so put your best foot forward so people decide to come and see you present your abstract. A second thing to consider is that your abstract often will be published in the journal associated with the conference. Abstracts from American Heart Association or two American Heart Associations are published in circulation, so a huge audience for your abstract, and you want to, again, put your best foot forward in writing this abstract. So finally, you've gone through all these steps, you've had it reviewed by many people, you've reviewed it again yourself, you're happy with your abstract. What now? Well, you have to sit back and wait. There usually are several months between the submission and the notification process before you hear about your abstract. And if it's not accepted, try again. Many people give up if something isn't accepted the first time. Well, everybody has that experience, and if we all gave up, nobody would be submitting anything. So please consider revising and resubmitting to another venue your abstract that you worked so hard on. I'd like to finish off with two final summary slides. First off, know your audience and the reviewers. So pay attention to what we've said in this presentation about the task that reviewers have and what they're looking for. Understand your audience and submit your abstract to the appropriate professional organization to have the proper audience. Heed the call, meaning pay attention to the instructions, and proofread. Many times proofread your abstract. Get a good critique. Don't accept kind words. People seem to think that you really don't want a good critique when you give them something, and you need to say, I do. I want you to be brutal with this abstract because reviewers will. And you want to get a good critique so that you can revise to have the best abstract possible. Don't waste words. Be very succinct and precise. Make every word count. Finally, you want to make sure that you have been very internally consistent in writing your abstract. That means that you have a strong, informative title. You have a concise but compelling background that's understandable by a knowledgeable layperson. You want a purpose that follows from the background and informs the methods and results, and then the conclusion that relates back to the purpose. You want a strong methods section. You want results with informative data and use tables and figures. Don't be afraid to use those to make an impact when appropriate. And then finish up with a conclusion that interprets and doesn't just repeat the results. Susan and I hope that following this series of suggestions for writing a good abstract results in positive results for you, that your abstract is accepted. The best way to learn how to write a good abstract is to write them over and over again. So write the same one over and over to get it perfect, but then keep submitting. Submit abstracts, whether your first is accepted or not, to subsequent meetings. Submit that abstract if it was not accepted to another appropriate meeting. Submit a new abstract to the meeting the next year. But keep on trying, and with really good attention to the details we've pointed out, and good critique and mentorship from someone who's been successful writing abstracts, we know yours will be accepted too. And we look forward to seeing you present at the American Heart Association.